How about taking a moment to thank the front line? How about thinking of others who can't stay home? How about fighting to get these workers protection? How about standing up for the ones we love? Thank you, doctors. Thank you, nurses. Thanks for working the front line. Thank you, scientists. Thank you, pharmacists. Thanks for working overtime. How about reining it in for the bigger picture? How about putting another before yourself? Hey. How about appreciating
Hello, everyone. Welcome to this very special web event organized by the Women in Science and Healthcare at the National University Health System in Singapore and the Equal Opportunities and Career Development Office of the Yong School of Medicine, National University of Singapore. As WISH President and head of the Division of Infectious Diseases at the National University Hospital, it is doubly my pleasure to welcome you to a day in my life, Women Battling COVID-19. The mission of WISH and EOCD is to advance women in science and healthcare, create an environment, and shape a culture that advances gender equity. We aim to raise awareness and promote diversity and inclusion in the workplace, ensuring that women are able to not just enter, but advance in their medical and scientific careers. To this aim, WISH holds regular lunch and learn sessions to provide women in our fields a platform to share their life experiences, gain new perspectives, inspire transformative ideas and actions, and build networks. Although the pandemic put a temporary halt to our planned initiatives, we are excited by the opportunity of hosting a WISH webinar trilogy starting today, a virtual version and space for networking with colleagues in the region, many of whom generously supported this event on social media. I welcome you and I thank you. As you know, many men and women within our healthcare institutions have been and are continuing to work tirelessly in our battle against COVID-19. Among them are women serving in various capacities and roles. Today, we take this opportunity to hear some of their personal stories, thank them for their efforts and sacrifices, and importantly, celebrate their contributions. We will hear from 3 live panelists and 3 pre-recorded panelists as they share a day in each of their lives. Our live guests will also have a chance to reflect and answer questions on what sustained and inspired them over the past 6 months. I am now pleased to introduce my co-host for today and for our upcoming webinars. He is Raymond Chow, Vice President, Central Asia at Becton Dickinson. He's a diversity enabler and a he-for-she champion. Raymond, over to you.
Thank you so much, Sophia, for that introduction. It's actually very, very encouraging for me to be a part of this. Thank you for inviting me and having me for this very inspiring project. I'll take this opportunity to do a plug for BD. I am actually leading the organization here in Central Asia, as you mentioned, Sophia. BD is a global medical technology company that is advancing the world of health by improving medical discovery, diagnostics, and the delivery of care. Here at BD, we have been actively working with the healthcare and research institutions around the world in this current battle against the COVID-19 pandemic. First of all, I would like to welcome everyone who has dialed into this virtual celebration that we have today. I know this is the first of 3. Very glad to be a part of this. So in this very exciting hour, we will be sharing personal stories, wonderful and inspiring people. We'll be having robust discussions, some fun along the way. And again, as you saw in the marketing ads that have come out, a wonderful surprise at the end of the hour. So I would encourage all participants who have dialed in to please stay till the end. Please stay for that big surprise that we have for you. One area that we want to remind everyone as well, this probably will be a one-way audio that you will hear. So all your comments and questions for those who have dialed in, please look at the Q&A box that you'll find at the bottom. Click on that and you'll be able to write down those questions, and we will make sure that those questions will be answered directly in that Q&A chat box. So just a reminder, do stay with us till the very end for that big surprise. We have a very exciting lineup of speakers for you, as well as some very robust discussions. And also, please put in those questions in the chat box, and we will be responding to those throughout the full hour. I will introduce our very first speaker today. She is none other than Madam Kutiyamal Sundarasan, a chief nurse at Ng Teng Fong General Hospital, part of the One NUHS group. In recognition of the outstanding contributions, Kuti was conferred the prestigious President's Award for Nurses in 2017. And more recently, she has been leading the response for Ng Fong's nursing community and the wider NUHS regional health system to the COVID-19 crisis. With great pleasure, I'll introduce Kuti.
Thank you, Raymond. And hi, everyone. Good afternoon. I'm sure all of you acknowledge that nurses play a very important role in the healthcare service, and nurses actually make up the entire background of the backbone. They are the backbone of any hospital. And it is this important group that I'm taking care of. And as the chief nurse of these two hospitals, both Ng Fong and Jurong Community Hospital, my main responsibility as a chief nurse is to take good care of my nurses, so they in turn can be empowered to take good care of our patients. A day in my life is all about the day in the lives of my nurses. So allow me to take you through the day in the life of my nurses. The workload of the nurses have actually increased manifold over the years. However, with this COVID situation, since the beginning of the year, it has really worsened. And the nurses are spread thin throughout the two hospitals, and they have started working even beyond the boundaries of the hospital. So they are actually working in the wards, in the ICU, in the emergency department, and outside we are looking after patients or the migrant workers in the dormitories and in the community care facilities. So the capacity in the ICU and the ED has expanded. The patients in Ng Fong, we have moved patients into tents, into community hall, into the basement car parks, have been converted to house patients as well. So we all know that this can only be done because of the strong support of the nurses, their compassion to care for others. The nurses care not only for their patients, but also for their colleagues, and their commitment to their profession. So my contribution to their work is to make sure that all the staff, my nurses especially, have the required resources to do their work well, and they can understand and interpret the ever-changing protocol and guidelines that comes out almost every day, and make it simple for them, streamline the processes for them and all. So that's my important role. And also, out of all this, I have to care for their emotional health as well. Because like anyone else out in the community, the nurses also do have fears. They fear for their family, they fear for their own health as well. So it is because that this group is somebody that the healthcare cannot do without. The World Health Organization has now recognized nurses as to be the most important backbone of the healthcare, and therefore they have declared the year 2020 as the year of the nurses, the International Year of the Nurses. When we say this, we will all agree that nurses are very important in healthcare, but does everyone outside healthcare agree on this? Do they think that nurses are the most important person? Because nursing is a predominantly female-dominated profession, at the home front, I don't think all my nurses are getting their supports, okay? Because anyone will tell you that when they come to a hospital for admission, they look forward to having a nurse to care for them 24/7, right? So they know that they have somebody whom they can talk to, who will care for them and all that. But at home, do they get the support to come to work, to do what they do here well, and to carry on with their career? So there was this one fine day that I had a young lady, my nurse, a young mother. She came to me crying. She said, CN, and that's what they call me, CN, I have to resign. I have to give up my career. So my question was, why? Then she said, my spouse said I have to resign and stay home and look after the family. But I was saying, why? So these were the exact words she told me. Say, my spouse said, you are just a nurse. It's easy to give up your career. It's not so easy for me. So I had to console her, and I cannot interfere with her family. So I had to suggest other things, and eventually she settled for a year of no pay leave. But so this is the point that I'm trying to make. Is it easy to give up the job of a nurse? Is it all right for the nurse to give up her career? She loved the job, and she has a passion and commitment for that job, but she had to give up. Okay, so we cannot, it's not easy for anyone to come into nursing just like that. They can't just walk in and be a nurse. It takes a lot of commitment. Nursing is not only science, it's also art. There are people who you pay them thousands of dollars will also not take up the job because it's not an easy job. It is not a job for everyone. It's only the ones who has the heart in the right place, the compassion, the commitment that will take up the job. And it's not easy. It's not just walk in and be a nurse. You have to have 3 to 4 years of nursing education, and you need years of experience to become a good nurse. So it is not at all easy for them. Okay. I have been blessed because in my younger days and now, I have a very supporting family. They have supported me all the way. And that's why I'm here today, doing what I'm still doing. Okay. So being a nurse is very important to us those of us who care for others, those of us who want to do our best for patients. So it's not so easy, and I hope that everyone will support nurses. And these are some of the slides where my nurses work, and this is a community facility. You see, these are all nurses. They are out there looking after the COVID patients. And this is what I do. I support my nurses, bring them together, give them motivation, encouragement, and everything. And this is what I want to say. To do what nobody else will do in a way that nobody else can do it, in spite of all that we go through, that is to be a nurse. And thank you very much.
Thank you so much, Kuti. First of all, I think it's great sharing that you are able to share the things that you and your band of nurses are doing all across the globe. I think that's something that not everyone knows, and I think the struggles that you have to go through. I think those are different experiences that not everyone who is involved in this can actually experience, and it's good to be hearing it directly from you. One quick question. I know we probably don't have a lot of time, but I think one important question that probably most people would like to hear from you as well is what are some of the experiences that you have had that helped build your resilience and to stay in the profession that you're in and help the many people out there?
See, for me, I have been in the service for about more than 40 years. And I think every day, being a nurse, every day is a challenge. Every day is new. Every day you learn something new. In the way we work with patients and our colleagues and everyone, we learn from their experiences and our own experiences. And that is what has helped me to build up my capabilities, build up my resilience. And of course, when patients thank you for what you have done for them, that is the reward that we get. And that motivates us to do more, stay on the job.
That's great. That's great to hear. We have a few seconds left. Just a quick question for you. As you battled through this pandemic, we're all in this together. Is there anyone or a team that you would like to thank on this platform while we have this opportunity?
Well, I'm not sure if you still can see my slide. I would like to thank my family. They have been a great support for me. They are always behind me. So they've always been very supportive. And of course, the persons that I would like to really thank is the group of nurses that I have. And the nurses have been wonderful. They have stood by me and to help us fight this battle. And they have accepted my decisions, they follow my instructions, because we have been opening more and more beds, and they will just move to wherever I ask them to go. And it has been this steady group of people that I really would like to thank. And of course, all my colleagues who are around us all the time. And this weekend, 1st August, is Nurses Day. So I'd like to take this opportunity to wish all my nurses a very happy Nurses Day.
Thank you so much. Thank you so much, Kuti, for the great sharing. That was very inspirational. I will next move on to our first pre-recorded speaker. She is a Deputy Director at the National University Health Systems in medical education. She coaches healthcare professionals in the areas of empathy and compassion, communications, mindfulness, and stress reduction. She has been on the front lines with the swabbing teams in recent months, where she has famously said, "We learned to smile with our eyes." Let us all spend a day in the life of Dr. Melina Supaya.
I'm Melina Supaya-Cabot, Deputy Director for Clinical Education, Residency Office, as well as Simulation Center at Ng Teng Fong General Hospital. A so-called typical day before the outbreak would be involving mostly meetings as well as coordination for programs, coaching staff, and teaching as well for students. I think in general, when our students succeed, our trainees succeed, they go on to be professionals and they are doing well. That's a proud moment. I like the fact that women are given opportunities. Slowly, I'd like to see more parity, equal footing in various departments as well as various levels, even at leadership. That would be a step forward, and I look forward to that.
Thank you, Melina, for sharing that with us. Melina is also a member of the WISH Executive Council. And it is now my great pleasure to introduce my colleague in the Division of Infectious Diseases at National University Hospital, and our next live panelist, Dr. Gail Cross. Gail is a mom of 2 kids, an ID physician, and a PhD candidate. She's been the clinical director of the ID division from 2018 to mid-2020, where she's played a key role in the COVID-19 response. Her dream is to help build a better world for women, for people of color, and for her children. Let's hear a day in her life. Gail.
Thank you so much, Sophia. I'm going to start sharing my screen straight away. Very quickly, at the peak.
Apologies, everyone. We seem to be having a problem with the audio. If it's all right, I think to do justice to Gail's portion, what we'll do is we'll cut into the second pre-recorded video and then circle back to Gail.
My name is Grace Chiang. I'm the COO, Chief Operating Officer of Alexandra Hospital. A typical day will usually start with a meeting. Most times we will discuss workload, how staff are coping with the different types of patient profiles that we experience. We will also talk about some of the challenges the patients may be facing in Alex itself. My proudest moment in AH as COO, I would say is the seamless takeover of Alexandra Hospital from Shenggang Health. We had 14 months to also set up 66 IT systems. The patient journeys, we had to put together and design the patient journeys as well. And we also put together all the SOPs that's needed to help us with our licensing. You know, as a women leader, women has many roles. I'm a boss to a team. I'm also a caregiver to aging parents, a spouse to my husband, and a mother to lovely children. During these challenging moments, the great support that we have in Alex has been very meaningful for me. I needed to be away when my mom passed away, and that was a couple of days after we took over Alex from Chenggang Health, and everyone jumped in to just help me. I'm glad for their support and their lending a hand.
So we've just heard from Grace Chan. Grace is the Chief Operating Officer at Alexandra Hospital. That entails overseeing the setting up and operations of the hospital, covers infrastructure development, hospital planning, and inpatient operations. All of this long-term planning has been crucial for the hospital's ability to respond to the COVID-19 pandemic this year. An incredible job by Grace and her team. What we might do next is, while we are trying to deal with the technical difficulties of the audio, unless Gail is ready, what we might do is I hand over to Raymond and Bintu, our next live speaker, and circle back to Gail.
I'd like to introduce the next live speaker we have. She has had over a decade's experience working within high containment laboratories around the world, including establishing a clinical research BSL-3 diagnostic laboratory in South Africa. Her main research involves using imaging to understand high-risk infectious agents such as SARS-CoV-2. This year, she has added on the role of coordinating the COVID-19 specific research within the NUHS MEDBSL-3 core facility. It's with great pleasure that I introduce Dr. Bintu Ahidjo. Hi, Bintu.
Hi, Raymond. Good afternoon, everyone, and thanks very much for the very kind introduction. I don't know, a day in my life is there's no standard day in my life. I think it depends on the needs of the day, but usually what we try and do is get all of the meetings done in the morning and then go into the laboratory to do the actual work, and roughly about 8-9 o'clock head home, have some dinner, and catch up with the rest of the paperwork. But this obviously varies depending on the needs of the day. What I could potentially do is show you a little bit about what we've done since the beginning of the pandemic. And I need to really emphasize that this has not been a singular effort. This has been an effort that has been we've gotten a lot of support from the senior management, specifically the Dean of the School of Medicine. We've gotten a lot of support from the Vice Dean of Research, and of course our Director, Justin Chu. So essentially, just to give you a little bit of a summary of what we've done. So once we realized that there was SARS-CoV-2 was getting into our shores, we basically, from, I would say, the week of Chinese New Year, we started doing lab preparations and revisiting our current standard operating practices and mitigation factors for handling this. We went through getting all of the approvals at institutional and ministerial levels to be able to handle this pathogen, because one of the things that does need to be said is that this is a risk group 3 pathogen, which means that we've had to do all of this work within a biosafety level 3 containment facility. There aren't many of these facilities globally. We deal with the challenges of not a lot of people like to wear PPE for extended periods of time. At NUHS, we need a minimum of 2 years experience within a BSL-2 laboratory, and training to work in the facility actually can take anywhere from, a minimum of about 6 months to be considered actually fully trained and certified and all of that. So we managed to do all of the administration stuff. We were it was good that we were able to help the National Public Health Laboratory with their surveillance. We actually received the first batch of patient isolates from NPHL around the 10th, or well, the 5th actually of February, and we successfully isolated the first virus culture 5 days later. We managed to, stain with neutralizing antibodies, and then we quantified all of this. So of course, all of this takes a really, really long time. And this is kind of the setting that we work in. This is within a BSc. So we've done drug screens. We've helped clinicians figure out whether or not the infection control measures that are happening within the National University Hospital actually are effective or not. We do a little bit of everything to help. So I think that's basically, I would say, a day in my life.
Thank you so much. Obviously, things are not the same as we had to deal with this, but as it hit us in early February, March, like you mentioned earlier, do you have any favorite aspect of this new normal that we're getting into right now?
I don't know about favorite aspects. I think what I would say is that the positive that has come out of this is it's pushed all of us to learn how to work smartly and more efficiently. I think there's a lot of prior to this, there was a lot of, if I can say, wasted time. Like now we've really had to figure out what are our priorities and how best to achieve our objectives.
Right. And again, a lot of dynamics happening because things change almost daily. And obviously you have to do a lot of changes and accommodate to these new changes. And along the way, obviously, a lot of human interactions. So obviously, you're working with the antigens, with the pathogens as well, but a lot of human interactions along the way. And that's so rich because we need to be collecting a lot of this information across different areas, different people around the world. Is there a relationship that has evolved unexpectedly during this last few months that you can share with us?
I must say I've been quite lucky. I mean, part of it is the time zone or the time differences, but I've been quite lucky in that this period has allowed me to reconnect more with friends, a lot of my friends and family from across the world. I mean, mainly I get the questions about, are we going to find a drug soon, and what are we doing? And also 90% of that time goes to debunking internet myths around the virus. But that said, I mean, it's good. It's been really good because I've been able to, have meaningful conversations with my friends and family.
That's good to hear. And I think if we look back, and you mentioned this earlier, where we have had to make changes along the way, and as it hit us, it was very quick, and we've had to communicate differently. We have to do many different things. But if we have to go back, we are in August soon. If we go back to a February, March timeframe, looking back at the things that we've done, would you have done anything differently if we had that chance to go back?
Actually, surprisingly, I would not have. I think we did everything the best way we could, understanding understanding the risks and given the information that was available to us. I mean, one of the things that I'm particularly proud of is the fact that when we developed these risk mitigation processes for working with this virus, this was weeks before like the WHO came out with, guidelines. And actually what was really nice was that every single thing that the WHO is recommending or any other international body is something that we had already implemented and we were already doing. So in that sense, I think we really did everything. I would not change a single thing.
That's good. That's good to hear. And I think, as you shared, and I think with many of the other speakers as well, there are many things that are done, in the background that no one knows so much about, and it's very good to be hearing it from you. And a very common theme is a lot of these work is actually done by women. and a consistent theme for success in getting this done is that you need that support both at work as well as at home. And it's often women that provides a lot of the support. And this event right now, WISH is an organization that wants to recognize women wherever it's happening. Is there someone, or either at home or at work, that you would like to highlight that has been extremely supportive, sensitive, and understanding during this time?
Absolutely. I mean, I think it's also important to say that it's not just women, but men also play an integral part in this. This was, of course, pre-COVID-19, but this is basically the team that our BSL-3 team that has essentially moved this forward. Nothing gets done in a silo. I would like to, of course, highlight our director, my boss, who's been incredibly supportive. And then the two who I would always say have been our MVPs during this period, our biosafety coordinator, Sindhu, as well as our head of the science and service support, Chikeng. They have both been really instrumental. Sindhu has had to field, I mean, we live and die by administration and paperwork, right? So she's really been instrumental in driving and pushing all of that, while also ensuring that we do things safely within the facility. And Chikeng has really been incredible when it comes to actually doing the work. We've worked over 10 hours within a BSL-3 facility with, not going out, basically just sitting and doing the work, because the process of just taking off the PPE is quite a challenging one, I would say, and in order to make sure that we move projects forward. And without that kind of support, I don't think we would have done half as much as what we did. And then, of course, I have, this is my family, and luckily, again, this is, the time zones help. So by the time I get home, my nieces are awake and basically playing around. So I do get to see them.
And that's very encouraging to hear the team behind you. Obviously, many women and some men in there as well. You talked about time and how you spend them at work and then heading home as well. We all know we have 24 hours in a day. How do you, in a few seconds, tell us, how do you maintain that efficiency? Managing everything at home and at work during this COVID-19 situation?
I think this really has to do with the support of the team and the family members. We would not have been able to do that if we were not able to count on our team members and leverage on everyone's strengths and ability. And really everyone has come to the forefront, and everyone has worked over and beyond what we had actually, personally, actually initially anticipated. So really everyone played their part.
That's great. So thank you so much for that encouraging address to all of us. Very good to hear the work that you're doing. Obviously, everyone's looking forward to results coming from that. Thank you so much again.
Thank you very much for having me. Bye.
Thanks. So let me lead us into the next pre-recorded video. She is a research assistant and a part-time master's student in Associate Professor Herbert Schwartz's laboratory. Her research involves the investigation of CD137 and CD137L in tumor immunology and autoimmune diseases. She focuses on the potential therapeutic applications in targeting CD137 and CD137L in autoimmune diseases. Let's spend a day in the life of Emily Nichols.
I'm Emily Nichols. I'm a research assistant under Yong School of Medicine in NUHS. So a typical day will involve doing experiments or helping my colleagues with their own work, and also maintaining any animal work that we do in our laboratory. Being a phlebotomist, so I help to draw blood for any of my colleagues also whenever they need it for their experiments. Proudest moment would be when our research lab has managed to start a clinical trial. So it was a work that was done by many PhD students or master students from the very beginning. And it took a lot of dedication and hard work to actually get to where we are, to get the clinical trial to be established and to get it kickstart and going. So I've been very blessed to have a good boss who doesn't have any gender preference towards males or females, and he encourages anyone who is passionate in science. So he allows me, for example, to take a greater leadership role when it comes to being part of the clinical trial, which is something I'm really very appreciative of, and I'm blessed in such a way.
Thank you, Raymond and Emily and Bintu as well for that last segment. It is time now to circle back to Dr. Gail Cross, whose slides were so fabulous they almost crashed the interwebs. Gail, I'm going to turf it over to you. Tell us a little bit about what a day in your life has been like.
Okay, so this is really going to test me because I have no prompts, but so be it. So I'm not sure where I was up to, but essentially my day starts with my kids waking me up, very tired mum in the morning, shoveling breakfast in and rushing across town to work, to a very important meeting, one that I had with Dr. Lionel Lum, Dr. Amelia Santosa, and with Sophia. And at this meeting, we would sit around the table in what we call the situation room, and we discuss the new workflows that MOH had instituted from, at 2 o'clock morning the night before, or perhaps, putting out some spot fires that had developed overnight or since the previous meeting at 5 p.m. In terms of managing the COVID-19 patients and the suspects in the hospital. And I think primarily at this meeting we had two focuses in mind. And the first was we absolutely wanted no nosocomial transmission to occur in the hospital. That means no healthcare worker and no patient should get COVID-19 as a consequence of the procedures that we instituted in the hospital, and absolutely providing excellence in care to both the COVID-19 patients as well as everyone else. So that was our mandate, and that was what we started off the day with, everyone with that in mind. So it was essentially a really important meeting for us to have, and it really set us up for the rest of the day. So the rest of the day started off with some ward rounds, of course, and we had patients in 2 different camps, essentially. Forgetting about the general patients that were admitted to the hospital, of course, now we had 2 new groups of patients. Those were patients who were suspected of having COVID-19, who were held in single rooms, in which we had to don and doff our PPE, seeing them for every patient that we saw. And that really meant, our ward rounds would take sometimes 2 to 3 times longer than otherwise. And of course, I just want to be clear, it wasn't myself, of course, doing this on my own, and neither was it really the Division of Infectious Diseases alone. It really was the conglomerate and collaborative effort of the Department of Medicine. When we asked for help to manage these patients and manage these wards, there wasn't a single physician who didn't put their hand up to say that they would help us. And for that, we are forever as a division indebted and grateful. But of course, we wanted to provide these patients with some specialist input. So the ID division saw itself augmenting some of these efforts. So whether a decision was made as to whether this was a true COVID-19 suspect, should we do 1, 2, 3, 4 swabs in a patient who had respiratory symptoms? And then on the other side, the other group of patients was, of course, patients who were confirmed to have COVID-19. And I guess I was just reflecting on this earlier today. The difference that we had here in Singapore in comparison to perhaps in New York, Spain, and Italy, where there was such a high morbidity and mortality from this disease, we, to be fair, didn't see that here in Singapore. And I'm ever so grateful that we didn't. But what we did see was the emotional toll that this disease has on the people who get infected by it, and the people, of course, their families that surround it. And that really came into fruition, I think, when I have one slide here where it's copying a test sheet, copying the test results or his exam results from a partner. Singapore was held up as the bastion of how you do a pandemic right. And that very quickly came undone when the outbreak happened in the dorm. in my personal opinion, I still think it's handled beautifully well, incredibly well for the challenges that Singapore and Singaporeans faced. But it was still heartbreaking to have these men away from their families come into hospital. I think as a doctor, whilst you're trained scientifically and you're trained medically to handle a disease, we probably aren't as well trained to handle a situation like this. The emotional toll, something as scary as being in the midst of a pandemic, particularly when you're so displaced. How do you deal with it as a physician? How do you provide comfort to men who were so fearful of what was going to happen to them and what was going to happen to their families, and would see them again? So that was incredibly challenging. The emotional toll that COVID-19 took, let alone the number of meetings that were held, let alone the long ward rounds, sweating under lots of plastic. All of that really paled in comparison, I think, from my experience, to really having to manage the burden of trying to deal with fear, deal really with anxiety and the fear that this virus has, got the world in its grasp, in its hands. So that was really incredibly challenging. But, on the other side, and this is something we also reflected on, I think, as a group, as a unit of doctors and nurses, is the camaraderie that we built amongst people that we wouldn't have worked with as closely, amongst the loss of hierarchy, really, senior doctors and junior doctors working hand in hand, nurses working with doctors, working with every single aspect, every single healthcare worker together to work together to overcome what was incredibly challenging for all of us. I think that the camaraderie that was built was beautiful, was, in a word, really beautiful.
I think you answered the first of your questions as well. Who or what has encouraged, motivated you despite these challenges? And I think you said it pretty beautifully yourself. If I may lead a little bit towards looking towards the future. So you shared what has been happening in the past few months. Are you looking towards what is your aspiration for a day in your life a year from now?
Well, I think the one thing, I'm not sure, in a year from now, Sophia, I'm not sure my life is going to be all that different. I feel that this virus will be with us for a while longer, and I think we'll have to learn to live with it, and we are. But if I could move forward and perhaps say what my life is going to be like in 5 years, where I envision myself, is I think that the virus is also been a gift in a way, because it's brought to the surface a lot of health inequalities, a lot of social disparities, inequalities that I have always felt strongly about, but never more so than now. And I think in 5 years from now, I would like to see myself working in that space, in that realm, whether it's policy development or really in that field to overcome these inequalities that shouldn't really exist.
You've spoken about the strength that you've drawn from others, both at work and outside of work. Would you like to say something about, is there a new me time moment that you've discovered during the past few months? So how do you find resilience from yourself, I suppose, from within, and what can you share with our listeners?
Well, actually, I think that's something I didn't do that well early on. This was also new. And I think that resilience is probably something we all have, but knowing how to harness it is really important. I think one of the mistakes that I made, and it's a journey, it's about learning about yourself, is I frayed. I definitely did. I came undone a few times, I think, because of the emotional, physical, mental toll that the pandemic took on me, and I feel on a lot of us. And learning that you really need to look after yourself, because you absolutely cannot pour from an empty cup. that is something I continue to grapple with today. I need to learn to do better. And being a busy mom of 2 young children and doing my PhD and still having the demands of a full-time job, it's never easy, but I will not give up. It's not impossible.
Thank you for saying out loud what many healthcare workers have experienced in private and also shared within our communities and our families as well. If I may proceed, slight change of topic with the next question. So there has been definitely within Singapore and globally an outpouring of support towards essential workers, including healthcare workers, but others as well. Is there a person or group who you feel might perhaps not get their fair share of recognition that you'd like to raise our awareness of?
I think that's really been something that has been really heartening to see is that Singapore has done so well in recognizing people from all sorts of jobs, all sorts of levels, whether, from our dorm workers to really every person whose work is clearly now has been valued, and I hope will have a monetary value assigned to it as well one day. That's the social change, that's the direction in which we're moving. I think that if there's one thing that we need to, as a society, perhaps recognize is I worry about the economic fallout from this virus, and I think that perhaps we need to focus more now on within the mitigating measures that we got to prevent this pandemic from taking off, and we could very well see a second wave, is within that still being able to support industry, whether it's a coffee shop down the road, going to get coffee, going to get two, buying masks from local people who make them, visiting your favorite restaurant once a week or twice a week, just doing the things that are going to build back the economy, I think is going to be really, really important, because that toll, I think, will last quite a bit longer than these few months of struggle I've had.
Thank you, Gail, and thank you for once again thinking on your feet and without slides to prompt you, which so many of us physicians feel are a crutch. Thank you for that. I will now go on to remind our participants to please use the Q&A box to write any comments on questions that you have for us, including some of our offline panelists. And remember that surprise that we promised you at the beginning of this program. It is my great pleasure to introduce a live performance as a gift of WISH and our organization to you by Miss Alame Fernandez. Alame is Singapore's veteran jazz singer. She has been called one of the best jazz singers in the world and has performed internationally with the likes of musical greats like David Foster. It's my pleasure to introduce Alame. For those who would like to sing along, feel free to Google the lyrics to the songs and take an opportunity to use this as a musical me time in the middle of your days. Alame, over to you.
With each passing day, we've come so far. You don't throw it away. Live believing, dreams are for weaving, wonders are waiting to start. You live your story, faith, hope, and glory. Hold to the truth in your heart. If we hold on together, see us through to forever, where clouds roll by. For you and I see souls in the wind, must learn how to bend. We'll seek out a star and hold on to the end. Valley, mountain, there is a fountain, washes our tears all away. Words are swaying, someone is praying, please let us come home to stay. If we hold on together, I know our dreams will never die. Dreams see us through to forever, where clouds roll by. For you and I, when we are out there in the dark, we'll dream about the sun. In the dark, we'll feel the light warm our hearts. Everyone, come on, sing with me, everybody. You know the words. If we hold on together, I know our dreams will never die, 'cause dreams see us through to forever, as high as souls can fly. The clouds roll by for you and I. Thank you so much, everybody. I hope you're all doing very well. It's so nice to be here celebrating with all of you. Very good afternoon. That was If We Hold On Together from the great Diana Ross. And I'm sure you were singing along, so thank you for that. I'm just going to do one more song to close this amazing event. And once again, congratulations to all involved. My name is Alame Fernandez, and it's such a pleasure to get to sing these two songs for you. This is the last song. We're wrapping things up as you do your Q&A. So continue to send in those questions for our MCs. And I'm going to do, like I said, this is the final number. This one I really need you to dance along with me, okay? This one's a party one, okay? Are you ready? Here we go. Here we go. Get ready. Put your party shoes on, everybody. Time to say goodbye and sing along. I know you know this one. You can clap too. Don't be afraid. Here we go. 1, 2, 3, sing. We are family. I've got all my wishes with me. Come on, everybody. We are family. Get up, everybody, and sing. One more time, sing it. We are family. Hey, yeah, yeah. I've got all my wish sisters with me. Come on, wish sisters, sing it with me now. Ooh, here we go. Everyone, they can see we're together as we walk on by. Yeah, we fly just like birds of a feather. See, all of the people around us, they say, can they be that close? Yes, we can. Let's let me state for the record, we're making love in a family dose. Everybody sing, we are family. Hey, yeah. I've got all my sisters with me. Where are all my sisters? Come on, sing it with me. Get up, everybody, and sing. Say, we are family. You know we all are. Say, I got all my sisters with me. Yeah. Come on, here we go. Say, living life is fun, and we just begun to get our share of this world's delights. High hopes we have for our future and our goals in sight. Yes, they are. No, we don't get depressed. Oh, here's what we call our golden rule. Have faith in you and everything you do. You won't go wrong. This is our family jewel. Come on, sing with me. We are family. Hey, yeah. Oh, come on, everybody at Wish, sing with me. Say, we are family. Yeah. Get up, everybody, and sing. Oh, yeah. Hey, yeah. I got all my sisters with me. Hey, yeah. So get up, everybody, and sing. Come on, one more time. Woo! Ooh, we are family. Yeah, yeah. I got all my sisters with me. Hey, 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 hey. Everybody, you know. Thank you so much. You have a wonderful day. Back to the MCs. Thank you.
Thank you, Alame. Yes, I think it would have been hard for me to imagine 6 months ago that I'd be in my office dancing and singing along to We Are Family by Alame. And at this point, we're going to bring our web event to a close. Thank you so much to all our participants. We are going to show you what we have coming up in a couple of slides. For the webinars we have planned for you in September. Easy dates to remember, 9/9 and 11/11. This is the next one coming up. We will take a closer look at women in academia, the impact of COVID-19, and then coming up in November, women in the workplace, specifically in the science and healthcare sector. And finally, thank you all for attending. Thank you all for the support that you have shown to gender equity issues, to matters of healthcare, responding to the pandemic. It's been a remarkable journey for all of us here at WISH. And we would like to say personally a thank you and goodbye to all of you while we bring this webinar to a close.
I also want to take this opportunity to thank everyone for inviting me and being a part of this. And as a final reminder, the chat box remains open. So continue to put comments and feedback in there. If you have further questions, please do put that through as well. Thanks once again for having me join this event. Thank you.
Thank you and goodbye, everyone.